Medical Center. But obviously, we value his perspective as it has been one of the leading voices throughout this pandemic. So just because he resigned from the PAG, I don't feel that renders his opinions or his points of view useless. And so thanks for coming on. With that being said, Doc, I got to say, you were one of the voices early on predicting this surge, calling for the measures. And here we are, 181 cases reported last night, hospitalizations 45, 26 unvaccinated, 17 vaccinated. So not really much of a difference there. 150th death. Doc, you mentioned the last time we talked that it's going to get worse. We're still climbing up the hill. How about today?
Yes, we're still going to get worse. We still climb up the hill. We had to do things significantly different in order to kind of curb this surge here. And it's including initially from the testing strategy. And again, testing strategy is really helped to identify the positive in a very rapid fashion that we can let the people know, isolate at home, so kind of decrease the transmission of the virus to other people. And that's the one of the key battle is rapid identification of the positive or the people that are infected. So it started at the clinic level and started at the testing fairground antigen. So I think that they are now finally moving away from the PCR testing, which kind of greatly delayed the identification of the positive. And I think they're going to use now the rapid antigen test, which is better than the PCR in kind of identify the positive right away. So this initial move right here will help the curve of the virus. We are about 3 to 4 weeks late for doing that, but it's okay. It's better late than never. So I think that's the part where it's important for them to change into rapid antigen tests, and if they can, I think if they move to the Abbott ID, be better. But I think the rapid antigen test is a much better strategy than the PCR testing at this point. So thank you for listening, and I think that's the part where it's important for us to do that. The other part is that I can see that a lot of our business, GSRA and other business have put out a letter yesterday, voluntarily, asked the business to kind of curtail down to 50%. That will also help the curve to surge. There's only one business that I truly worry about is the bar. It's not to put on the bar in the same category or the same basket, but we know for sure 100% that in every surge and in Guam or anywhere in the world, just like Korea, Japan, that once the bars open, the numbers start to go up. So in this past few weeks, we identified like 5 or 6 bars that have cluster there, and public health have problem do contact tracing in the bar, as you remember. Because hard for the bar to identify the customer for various reasons. So when you have 100% occupancy in the bar, you ask for problems. I'm not quite sure why they are allowed to be 100% occupancy. So I apologize for the bar owner, just because I don't think the owner bar are doing the same thing, but the few rotten apple really make everything worse for everybody.
Well, we had Mo from Moses on, and she was even saying that it's hard at 100% capacity to kind of police everybody about mixing tables and wearing the masks. So, and I just got to say, what does it say to you when you have these businesses who pretty much for the whole pandemic have been, complaining that they haven't been able to open, and now they're saying, "Whoa, COVID is everywhere. We're going to dial back on our own without
Yeah.
anything coming out from the governor.
Yeah, I think that's responsible business, Chris Sabrina. I think they're responsible. I think most is one the responsible business that they identify that there's a risk, and I think she did a very good job and kind of put some restriction there at her place. And that's the reason why the responsible business, like most, I wouldn't. I apologize to put in the same place, but beautiful restaurant, very good food, and there's a bar in there, but they know, and they make the correction to themselves, like I say. But a few of them that have the cluster, and it's kind of hard to group in a one thing, right? But we know for sure that when you do 100% of the bar, which can have 100 people in the bar, I do not matter is a vax or unvax, they will transmit the virus and they bring it home. So that's one section of business that you really have to carefully look at and not allow to be 100% occupancy in order for us to curb this surge. Because, we know now that vax or unvax, we do transmit the virus the same. So that's why it's no sense to, again, continue to segregate our people into vax and unvax. We all need to be in one voice and do one thing and be respect each other. Back to basic with masks and social distance and washing your hand, and encourage people to get immunized to decrease hospitalization. But at this point, we have to do the testing, which they change now. Now they need to clamp down the gathering, especially in the bar stuff. So again, this isn't. I don't think anyone will question about 25 people gathering limit outside and 10 in the inside. That's So when you open bar 100%, it doesn't make sense because people will not stay in the table at 10. They will walk around with no mask on.
Right.
The restaurant, for example, Chris, I tell you, that's absolutely. I don't remember any breakout in the restaurant. They have the most mitigation restriction they put in place to keep the customers safe. And again, my hats to the restaurant business that they did so much in order to keep open. And right now, I don't remember there's any cluster in the restaurant. So,
there was
but very good to do that. So.
There was a Subaki, Doc.
Tsubaki is remember they closed it down. Okay, it's from the employee and it's not from the customer, right? I'm talking about customer brought it in.
Yeah,
So Tsubaki from the employee. So that's totally different things. And I don't think that so much customer that turned positive in Tsubaki. Is all the employee that turn positive. That's what I'm talking about. If they do mitigation factor, then the customer won't get affected, Chris Sabrina. So Baki don't consider a cluster because it's not the customer that get infected. It's basically the employee part. Okay.
Doc, I mean, you've advised the governor in the past, very recently. So why haven't we seen that call? I mean, for these businesses to come out and say, "Yo, everyone, let's dial back to 50% occupancy because the spread is rampant." Is it because the governor doesn't want to appear wishy-washy, where she's going to come out one week and then everyone took a big crap on her vax thing, and then she had to dial that back, and now it's if she come out and announce another measure, it's just too much? Because I don't know. To me, it just seems kind of like it's justified. Like we're in this crazy surge, and if these businesses themselves again are calling for self-limitation, which is pretty cool. I think a lot of people are doing that. A lot of people are kind of course correcting without the governor's leadership, which I think it says something.
Yes, I think, like I said, people are responsible, and again, business want to stay open, right? And I think because ultimately, if the number keep going up and stay triple digit, I think someone will reactively say it's going to shut everything down, and we're back to to pick on one,
Right.
and that's not what the business want, and that's what no one wants. So in order for us to work together, business are very responsible. So they did that on their own, just because we all have to stay open. That's the thing, because we all have to do this. But you have to have a great decision in order for us to help the business and the community and hold on together and go through this thing. Again, hard decision need to be made. So like I say, the only thing now on the curve this virus is, I'm going to ask again for the bar to be restricted. It doesn't matter to be vaxxed or unvaxxed. We got to stop doing that. Really, we have to stop. We all are the same. But we have to put a lot of restriction on the section of the business, which right now the only thing that I can look at that at risk right now is the bar business. But everything else, I think that they are holding their own and they take the necessary precaution already. So the challenge is the bar and restaurant mixture. Just like Mosa, but again, Mosa, I tell you, she did very good, and thank you so much for doing that. To do the changes that they make, just to make sure that the customer are safe. So I would say that that's a responsible business. So again, the bar needs to be restricted 100%. There's no doubt in my mind that data show there. I can name 5 or 6 bars, which I cannot. But the cluster is there. Okay.
Doc, we did have a comment here because we're seeing such a high number of positives, but and there's obvious hospitalizations, right? But a lot of people who are getting the virus are doing like the home treatment, right? Home isolation. So can we talk a little bit about the treatment angle of it? And I know you sent me something about Regeneron, which is at the hospital level. So maybe we could start like for those people who come in, who test positive, maybe milder symptoms, so they're going to do the home isolation. What works for that? And then what works treatment-wise in the hospital setting?
Okay. Oh, I'm going to approach this in a different way. Okay. Regeneron have been there since the last surge in August of last year. It's an IV treatment for outpatient, which is, it's really the only very effective mean for us to decrease your risk of being in the hospital or dying. If you have the early IV treatment with Regeneron. Okay, it's been available since August of last year. Remember we stand up a tent at GGRMC, and we set up the IV treatment, but we haven't used it, okay, since August of last year. And it saved people's life. I can tell you that some people's life probably would not be lost if this thing went in place in August last year, and that's after the fact. But it's something that it had to be identified rapidly at the test site. Chris Sabrina as a test site, okay? Because once you identify someone positive, the physician or the nursing staff have to do interview with the patient to identify the risk. Risk is, we have a lot of risk here in Guam. A lot of people will qualify for this. If you're over 65, that's one. If you have, symptom within 10 days to test positive, which a lot of people have. And the third one, their comorbidity. If anyone that have hypertension, diabetes, kidney disease, overweight, those are the 3 most common comorbidity that people end up in the hospital. If they can just have a number to call or a place to go, that they can have the IV treatment, which is only one time, and it takes about an hour and a half to give, it will save their life. They won't get sick. The chance they cut down the hospitalization. And it's something that we have since August of last year that we multiple times tried to stand up. But again, the question is, we keep hearing plan, but nothing happened. It had to start at the public health site.
Hey, don't start talking about public health now, because we're getting Shimon after this, and he's going to spend half the conversation like disagreeing with everything you just said.
If we cannot pass the message on right, and we cannot stop at testing. When you do certain tests, you have to be responsible to go to the next step, which is, you have to make the contact with the patient right away, okay, and identify, interview the patient. You just can't say the testing and then I tell you you're positive, and what next?
Yeah.
You have to answer the concern of the patient that turned positive, right? I mean, that's what set us back at the clinic level so much, because every time we have a positive that we will, when we have to take my time out, all my physician will call the patient, interview them, ask the risk factor, and refer to GMH or GMC for the IV treatment. That's the time that, again, the most positive I identify through public health. And that's what we really want to refine this thing to make sure that the process is not stopping at the testing, and that's it. My hand is done.
Yeah.
Because when you do the testing, you are responsible for the patient, and you have to do that. Majority of the private clinic take the time and do that. I mean, one or two don't, but again, most of the positive come from public health. So I think the guard are now standing up a process at the testing site to truly identify immediately the positive and offer the IV treatment. And like I say, this is where it's so important now that we have to search, because we have hundreds of people positive, and this is where we're going to need to be very aggressive with offer the IV treatment to people to decrease the hospitalization, because it's not all this hundred. The percentage of the people will end up in the hospital, and our hospital will already overrun by COVID already, and on top of the non-COVID admission. So again, it's very important now to educate the people out there that this IV treatment is available to you. So if you are from 65 or over, or if you're younger than that, which we have many in the 40, 50 that have diabetes, hypertension, kidney disease, or overweight, if you don't have a physician, I don't know, they need to stand up a number so people can call and find it.
Whatever.
I'm a clinic, then call your clinic and say, hey, I've been identified positive at the public health testing site. What do I do now? I think most physicians and clinic will take an effort to kind of identify your risk and get you the IV treatment through the two hospitals.
Mm-hmm. Whatever happened to Bamlanivimab?
It's the same, Sabrina. It's the same thing as antibody. The monoclonal antibody, which is the same thing as when you get infection and your body make antibody to fight it, right? So it's the same thing. It's the same idea go down the line is that, hey, if I get an early infection, in order for me to prevent from it getting worse, is you give me IV treatment, I have antibody to fight the virus and will help me cut down severity and cut down my chance to be in the hospital. Just like when just think this as IV antibiotic. If you have infection and I give you IV antibiotic, you get better. Yeah. Just think about the pain. Okay, so again, I've tried to educate the public, and so that way they know the treatment is there for them.
Yeah.
Because or the people don't know that's there.
Yeah.
So, Doc, we had 181 positive last night. The day before it was over 200. So there's all these people that are at home isolating, and I think just want to get back to Chris's original question. Yeah. What should they be doing? Like, should they be taking vitamin C, zinc? What should they be doing?
Lysol.
Yeah.
Yeah, there's a home list of vitamins that can take as home remedy it's not to cure the virus, it's just increase the immune system. You can vitamin C, okay. You can get vitamin D, D3. You can get zinc. You can place yourself on aspirin if you don't, if you're not allergic to aspirin, and you can get melatonin to take at nighttime. So those are the mixture of cocktail vitamins that people can take, and that's readily available over the counter, right? Just drive up to pharmacy. Yeah. Please don't get in. Or send your family member to get it for you, but you can take that at home. Rest, hydrate yourself, and that's what you that's what you do. And most importantly is really to monitor the symptom. Shorten the breath that you got to go to the emergency room right away. Okay, and the most important thing also is that people need to get a pulse oximeter at home. So that way it's like $20 or something like that, just to check your oxygen level. Because remember, we talk about the silent hypoxemia that can happen with the COVID virus. So you need to monitor your oxygen, because once you hit that level, it's too late for you in the hospital. You have really shortness of breath. So monitor your oxygen.
Yeah, Doc, when my son caught COVID, that was what the clinic had recommended was zinc, baby aspirin, vitamin D. But even when he took all those, he still he had the COVID with the aches, right, all over. So he was just so out of it, even with that cocktail of vitamins. So I guess it's just kind of case by case, right? Because some people have milder symptoms that those things would work better with.
Yeah. So case by case. But right now, what we concentrate on, Chris Sabrina, is identify the people that have high risk and get them the IV treatment. Like I said, you don't have to be in the hospital. So people need to know that, hey, it's an outpatient. Okay. So you come in, they do the workup, you spend about an hour and a half to get the IV treatment, and you go home. It's not admission to the hospital, so don't be scared of the hospital. So that's something that, now the challenge part is that the hospital is so short of nursing staff, and they overwhelmed right now. So I'm not sure how they're going to do this. This is where, our wonderful guards will stand up, and they do so much. And again, Chris Sabrina, this whole pandemic, I tell you, I have to say thank you to the guard member, thank you to the private sector, just like GRMC and all the private clinic. They pull a lot of weight that we never recognize them. So again, our healthcare system is not just GMH; it's the whole community, including our guard member. I'm a retired guard member. It's my big family. So thank you for them for keeping step up on the plate.
Doc, I want to go back to what you said about those who are overweight, have a hard time with the COVID. How overweight are you talking here? Are you talking like overweight, or how about if you're just a little bit husky, asking for a friend? What if you're just like a big boy,
You gotta check this.
Thank you.
I think they're talking about 25-30% BMI. So, a lot of us, including me, probably will fit in that category. So,
all right, Doc.
Really, to the public, that you have the Regeneron IV treatment available for you. Okay, if you test positive and you meet the category again over 65, okay, if you have high blood pressure, diabetes, kidney disease, or overweight, please call your physician and just contact. If you don't have a physician, just contact a clinic and inquire to see if the physician, the provider can hook you up and arrangement for you to go to one of the hospital to get the IV treatment. Don't wait until you get worse, because once you get worse and get admitted to the hospital, it's too late already. You can't get this one. So this one have to give before you get sick. So if you feel fine and you have those comorbidity, you call, okay? Don't wait till you start having symptoms. This treatment is mean to give you before you start to crash. Okay,
got it. Thank you, Doc.
Doctor's orders.
Doctor's orders. Ask for it by name. Give me some of that Regeneron.
And the vax or no vax, please, try not to go to gathering. You guys are the same. There's no different vax and no vax, okay? So I still highly encourage people to get vaccinated. So again, but you all should be treated the same. We are the same people, so we continue to be treated the same. I hope. Okay.
Thank you, Doc.
Thank you.
Thank you, guys. Be safe.
You too.
You too, Doc. You
Have a
too.
good one, Doc.
Yeah, have a good one. We miss you. Okay, there you go.
Bye.
Dr. Hoa Nguyen. He's the former Physicians Advisory Group chair, and he's one heck of a fisherman.
I forgot
7:33.
that he won, right? Didn't
Yeah, he got second place in the International Derby.
Mhm.
Wait, that was second? That
Yeah.
that big swordfish you got?
Yeah.
Wow.
At 7:33.
Doctor's orders. I like that.
Yeah, guys. So
The
that is.
governor has her executive orders. We got the doctor's orders.
Yeah. 637-0094.